Hi there, Dietitian Mel from Active Health Clinic. Today I'm filming a video to talk about some tips to help manage constipation. So I'm going to go through 3 tips today, but before I do that, I wanted to discuss how it's important to understand where your constipation might be coming from to help manage and relieve symptoms of constipation. Now, I understand that can be challenging because constipation can come from many different factors. Such as, supplements like iron supplements or stress or multiple stresses, certain conditions like EDS or Ehlers-Danlos syndrome being more likely to have a slower transit of food in the digestive system, and also your diet. So certain foods being either not enough, such as fiber, which I'll go into in a minute, or too much, like FODMAPs if you have IBS, and particularly have IBS-C, which is IBS constipation. Now, the 3 tips that I'm going to go through today are fiber, fluid, and movement. They are the 3 important ones that I like to talk about with patients whenever they come to me with constipation first, before we look at anything else. So fiber is important as it can be a really big factor in managing constipation. So fiber is part of a plant-derived food that can't be completely broken down by the body, and our digestive enzymes can't really break them down very well. So it's important to know there are 2 different types of fiber, and both are helpful in the management of constipation. So we have our soluble fiber, which essentially draws in water to the large intestine into the stool, creates like a gel-like consistency, and basically helps things move through very smoothly. So this is found in foods like fruits and vegetables, oats, barley, legumes, psyllium, or ground flaxseed are really good sources of soluble fiber. Our insoluble fiber can be found in whole grain breads, nuts and seeds, the skin of fruit and vegetables as well. And this insoluble fiber can't be broken down very well by the body, but basically it helps form the bulk of the stool. So it doesn't absorb any water. That's our soluble fiber's job, but it basically helps form the bulk and helps things move through smoothly. So that's why we need both soluble and insoluble fiber when managing constipation. The next point is fluid. So drinking enough fluid or having an adequate hydration status across the day not only can help with, having appropriate levels of blood for our blood volume and management in dysautonomia, and help with symptoms of dizziness, but it can also be really helpful to manage constipation because water will be absorbed into the stool, make it softer and easier to pass. So we need adequate fluid alongside the soluble fiber because that's a fiber that's actually going to be absorbing it and helping things move through the large intestine. And the last strategy is movement. So I won't talk too much of this being a dietitian, but we know that movement can help decrease the time that it takes for the stool to move through the large intestine, which therefore decreases the opportunity for fluid that we're putting into our stool to be taken out and reabsorbed into our body for use, especially if we are dehydrated. So that can, if that does happen, that can cause those really kind of hard stools that are hard to pass. So basically, if we move more, things are moving through quicker and it allows that soft stool to stay in there and then pass through. So those are my 3 tips: fiber, fluid, movement. Give them a go, and if you feel that there's just another missing piece with your constipation and you're really unsure what's happening, what's going on, please reach out to a dietitian. We are more than happy to help. Happy eating.